There are few questions before we departing for a lunch. The 3 क्वेश्चन आए हैं. सबसे पहला मैं नीचे से लेता हूं. डॉक्टर आदिल चिमथानवाला shows remedy in cardiac diseases. Which potency or medicine Q is using? कौन सी potency यूज कर रहे हो आप?
Pathological prescription for long term, low potencies, as low as possible, but not mother tinctures only. We can start with 1C, 2C, and or LM1. I normally use LM1 potency because it's easy to gallop. So, but if it is in an acute stage, see the patient, and the symptom similarity should match if we are giving symptomatic prescription. અને બાકી તો laws જે છે તો potency wise is totally case based.
And is based on susceptibility of the case and the sensitivity,
Yes.
totality.
And why you are giving?
Why you are giving?
If you are giving it only to maintain a particular parameter, ejection fraction only, then long term either mother tincture or low potency.
Or low potency.
If it is not available tincture. Then.
Sure. Thank you. Another question for Jain sir is, Varjan, how can homeopathy colleges fill the gap of insufficient OPD cases by collaborating with private homeopathy practitioners through MOU to improve the clinical training of students and interns under National Commission for Homeopathy Norms?
Collaborating with private medical practitioner for enhancing OPD, IPD is not something the part of regulation. Definitely you can collaborate with some specialty hospital where you can send to your students, your teachers for the clinical training and exposure. But you cannot collaborate with a private practitioner to enhance the OPD, IPD. However, we have made one very important provision in the regulation itself where we have drafted regulation for appointing practicing consultants in homeopathy. So instead of collaborating with any particular clinic or homeopathic doctors in your city, I would suggest that you invite these people in your own campus. For that, they don't need to be the trained teacher or having the teaching experience of so many years. No, we have defined their qualification. They have to be PG, or even if they are simple BHMS and carrying the experience of 15 years in clinics, they can be part of this group, practicing consultant for homeopathy. What you can do, that you identify any good practitioner in your own city, and every city has many such teachers and doctors and practitioners who are having wonderful practice in their private areas. You invite these people in your OPD, IPD, you make your student to sit with them, you ask them to take clinical classes, and you can take use of their experience. What I said in my initial deliberation was also that unless the teachers and students are sitting together, working together, and unless the student seeing how the patients are dealt with, then only he can learn. So best way is that you don't remain limited only up to your own teachers or your own PG guides or the faculty of your own institution. You invite people from the outside, ask them to sit in your OPD maybe 4 times, 5 times, 6 times in a month, and you take help of their experience. So that will definitely help in increasing OPD, IPD in your particular college.
So that's an idea. Key student, rather attending private OPDs, the private consultant should be invited to the institute OPD and IPD to take the advantage of their expertise. The last question, sir, it is a long question. Received through clinical training and research-oriented guidance from PhD qualified professors. What is the role of PhD qualified professors? का कोई role या NCH में कोई guidance या norms वगैरह है?
No, as far as PhD is concerned, PhD is not regulated by NCH. PhD is conducted by universities at their own level under the regulation and guidance of University Grant Commission. But it's not that we don't recognize or we de-recognize them. For us, for becoming a teacher, a minimum qualification is PG in homeopathy. So let's say if in your city you have some PhD doctors who are trained in homeopathy and who are already having MD in homeopathy degree also. So they can be called off. You can take the help of their research experience. But as I told you, this degree or this PhD is not regulated by NCH. So we cannot say that if he is BHMS and done PhD, then he can be employed in any university or any college of homeopathy. No, they cannot be employed. If they are BHMS, MD and then PhD, you can take help of these kind of professionals definitely. That's not a problem.
does it have any specific advantage of doing PhD, and that will help in any end of the NCH modality of appointments?
As I told you, sir, as far as regulations are concerned, there is no specific provisions for PhD done people. There is no specific provision. For us, the mandatory qualification is MD in homeopathy.
Okay. Thank you, sir.